Coming up on Mayo Clinic Q&A. Your thyroid gland is small, about the size of a strawberry, but its job is big, controlling your metabolism.
Frequency of heart rate, bowel movements, energy level, muscle strength, body temperature.
So when the thyroid isn't working well, either too hard, which is hyperthyroidism, or not enough, which is hypothyroidism, it can be a big deal. There are treatments, but who really needs to get those treatments?
We know that about 10% of people have some degree of thyroid dysfunction. The majority of people, though, have a mild thyroid dysfunction, and only less than 1% of people in the population, they do have what we call severe thyroid dysfunction that usually deserves treatment.
Welcome, everyone, to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. Thanks for joining today. Today, we are going to talk about the thyroid gland. The thyroid gland is in the neck, and it creates and produces hormones that play a role in many different systems throughout the body. There are many different types of thyroid diseases. There's hyperthyroidism, or high thyroid, hypothyroidism, or low thyroid, Hashimoto's disease, and many others. Joining us today to discuss thyroid diseases is Dr. Juan Brito, an endocrinologist at Mayo Clinic. Welcome, Juan.
Oh, thank you for having me here, and thank you, Dr. Gazelka.
Thanks for being here today. I think that thyroid disease is probably fairly common. Is that true?
It is common. We know that about 10% of people have some degree of thyroid dysfunction. The majority of people, though, have a mild thyroid dysfunction, and only less than 1% of people in the population, they do have what we call severe thyroid dysfunction that usually deserves treatment.
Well, I guess the one truth, Juan, is that everyone has a thyroid gland. So maybe we can start there with what is the thyroid gland and what does it do?
No, yeah, absolutely. So the thyroid gland, as you were saying, is a small gland. It weighs about 15 grams. So you can think about like a normal strawberry kind of size. Is located in the bottom of the neck. And the thyroid gland produces a hormone or hormones that control your metabolism. And what it means is that controls your frequency of heart rate, bowel movements, energy level, muscle strength, body temperature. And by doing that, it makes sure that you are healthy. It makes sure that you are consuming the calories in a healthy way. The majority of times you cannot feel the thyroid very well. It's not like it's just there and you can feel it very easily with your fingers. In fact, doctors have to do specific maneuvers to find the thyroid and ask patients to swallow. And I'm saying this is because as a clinician seeing patients with thyroid problems, many times patients feel that any lump in the neck is a thyroid lump, and it's actually very difficult to palpate the thyroid, and the majority of times it's not a thyroid lump, it's just muscle thickness or maybe lymph nodes. But in the majority of times, nothing is palpable in a way that patients can clearly feel that something is abnormal there.
Oh, that's very interesting. Today, we're going to talk about thyroid diseases. So who is most at risk of developing an issue with their thyroid?
We know that women are at higher risk than men to have thyroid diseases. People who have had radiation in their necks are more likely to have a thyroid problem because radiation can affect how the thyroid works. We know that over time has been some research suggesting that the thyroid might be working less, yet we are just understanding that working less during aging, meaning the older we get, the thyroid work less, is actually protective. And we know, yes, and we also know
why protective?
It's unclear the reason why, but what we have seen is that what is normal at a younger age starts becoming the number that is considered high at younger ages is actually considered more normal at older ages. And we know that this kind of different threshold in your system changes in a way that might be protective because you might not need the energy that you needed at different age groups to do different muscle kind of driven activities. You might doing other kind of activities. So it might be that the energy distribution and the way that we consume energy is different at different ages, different age groups. So at older we get, the thyroid might not need to work as hard.
That's very interesting. I imagine this varies by what we're talking about, but what causes thyroid disorders or diseases? Do we know that?
Yes, the vast majority of thyroid problems come from autoimmune problems. So the
Okay.
autoimmune means your immune system recognizing the thyroid as something different. Like if you think about a bacteria or a virus, it recognizes the thyroid and says, this doesn't look okay, and it attacks the thyroid in a way that either makes the thyroid work less or sometimes makes the thyroid work more, which is actually interesting because we always think about autoimmune problems as working less or inflammation, but sometimes the autoimmune problems can make the thyroid work more.
Interesting. So it's not easy to palpate your own thyroid. We already talked about that. How would an individual know if they were having a problem with their thyroid?
So there are two big problems with the thyroid. One, if you think about a structural problem, meaning lumps, that's one kind of problem with the thyroid. And the second kind of problems that one can have is how the thyroid is working. And the majority of times, actually, both have nothing to do with each other. You can have an anatomical problem, meaning lumps in your thyroid, or you can have a thyroid that is not working. And depending on what it is, one can have different symptoms. For instance, a nodule in the thyroid is actually very frequent. Almost 50% of people have nodules in the
Oh,
thyroid.
interesting.
And the majority of times, nothing happens. The majority of times, it is just benign lumps. And we never recommend patients to start palpating themselves to find these lumps. Like, for other conditions in which sometimes we tend to recommend self-palpation
Oh, right.
to
Like
find
self-breast
things.
exams, for instance, or something like
Absolutely.
that.
For thyroid, we don't recommend that because
Okay.
it's even in experienced hands, we are wrong 80% of the time. So imagine
Oh, wow.
10 patients with a nodule, 8 out of 10 patients with a nodule, we will not pick that up, or we will thought that we felt it when it's not.
Huh.
So our fingers are not good in that. And that's one thing. So we don't recommend that. So how do people identify that something is a problem with a nodule? Is when you can see it. And people say, oh, there is something in there, it's a lump there. So that's a different when people actually recognizing that there is a lump that people can see. And the other one is when the nodule is quite big, start compressing things around, and people start feeling pressure, feeling difficulty swallowing, even changing the tone of their voices. So that's when we say something is there. Of course, those symptoms do deserve ultrasound and seeing a doctor. That is for the nodule part. For the dysfunction part, it's very tricky. And the reason why it's very tricky is that the typical hypothyroid symptoms, meaning when your thyroid is not working well, are actually symptoms that happen regularly, even just happens because life put us in positions of stress. So fatigue, gaining weight, sometimes constipation, dry skin, hair loss. I can just describe 10 other conditions that do the same.
Yes.
So saying that you have to go to the doctor because the thyroid problem exists because of the symptoms is not a good way to tell the patients. Rather, the doctor should pick this up and say, you know what, some of those might be due to the thyroid, and let's check that up. Let's make sure the thyroid is working well. And when the thyroid is actually in the opposite direction, is working too much, those ones are very, very clear. It looks like when patients are drinking 20 cups of coffee, they feel shaky, palpitations, weight loss. They manage to lose 20, 30 pounds despite eating a lot, and also fatigue. So those ones, when the thyroid is working a lot, those ones are actually very easy to pick up because it tends to be more associated with the thyroid.
I can verify that one. I was treated for Graves' disease about 10 years ago, and I thought that maybe I was going crazy. I had terrible anxiety. I had palpitations. I was, had exercise intolerance, but I was really fatigued and had muscle aches. And finally, I went in and said, "Would you check my thyroid?" And sure enough, so.
And it was there. No, absolutely. And it's exactly the same. You just describe it, how patients come to us, are the symptoms, I think something is going on. I cannot handle heat anymore. I'm sweating all the time. It's a very unusual set of symptoms.
Yeah, very interesting. So you can't palpate necessarily. So how do you diagnose thyroid disorders?
So it's mostly about symptoms. We don't recommend, because there are two ways to find thyroid problems. One is screening, finding the condition when symptoms are not present. We don't recommend that. We recommend addressing when the symptoms are present. So as I told you, when the symptoms of thyroid nodule or thyroid mass they are there, of course, they need to be evaluated with an ultrasound. An ultrasound will take pictures of the neck particularly the thyroid, as well as the lymph nodes, and give a very nice picture to the doctor what's going on there, how many nodules there are, what is the size of the nodules, and if the nodule looks worrisome enough to do biopsies. And so the ultrasound is key in understanding whether or not we have to do something else for a nodule or a mass. And the opposite is checking the thyroid hormones in the blood. So if someone is presenting with symptoms of hypothyroidism or too much thyroid, a simple blood work will reveal what's going on.
Well, and I was thinking about what you said earlier, that the symptoms of hypothyroidism are, my goodness, they're things that, you know, happen to all of us at some time during life, maybe feeling tired, feeling dysphoric, gaining weight. And all of those things are so prevalent. So why not screen for thyroid? How do you know? Or that's just what the clinician puts together in the office and then decides to check?
That's a very good question. And in those instances will be case finding, meaning that we are trying to diagnose rather than screen, because screening will be those individuals that we just do the test and they have no symptoms. And okay. this problem will be patients that we think already might be something wrong with the thyroid, and we're just trying to diagnose them. But one has to be careful because having something abnormal with the thyroid level, it doesn't mean that that's the reason for the symptoms. So you can already tell, you know, if these symptoms are so frequent in the population at one point in our lives. So there is always a point in our lives that we're gaining weight. There is always a point that we feel tired and sometimes constipated. If we get to do thyroid tests and something is abnormal, it doesn't equal that the thyroid is explaining those symptoms.
Sure. But yeah, that makes sense to me. Just like I do pain medicine. And so I tell people that just because I see something on their MRI doesn't mean it hurts of their back.
Yeah, I think it's the same analogy. Is finding something doesn't mean that explains it.
Right. So Juan, how do you treat? We talked about hyperthyroidism is too much. The thyroid's working too hard. Hypothyroidism, it's not working hard enough, essentially. And so how do you treat those different disorders?
Very good question. So we have treatment, which is great compared to other conditions. And we do have a variety of treatments that we can use. When the thyroid is working too much, we actually have treatments that have been available for decades. One is to give a medicine that blocks the thyroid in a way that is producing too much, similar to blood pressure medicine. If the levels are too high, we just give you a medicine to lower the levels of thyroid hormone, and they are very effective. We can also have medicine that actually destroys the thyroid with radiation. Is a pill that goes into your system, recognizes the thyroid, and destroys the thyroid slowly. So the end result of that is that you need to take now thyroid hormone because the medicine has been so effective that destroy the thyroid. By destroying the thyroid, you're taking care of the problem that is causing too much thyroid. And the last resort is actually surgery as well, when the thyroid is working too much, and sometimes people cannot tolerate other medicines, the other pills, they can go straight to surgery as well. So when that's working too much, when it's not working enough, what we're trying to do is just replace what is needed. And what it means that is people taking thyroid hormone. The most common thyroid hormone is called levothyroxine, and that is actually one of the most prescribed medications in the United States, just to tell you how this has been going on for the last years. And the levothyroxine is the hormone is something that has to be taken every day for the rest of their lives.
And then Juan, how do you know whether the medications need to be adjusted? How often does the clinician check to see whether you need your level adjusted of the medication?
No, yes, we have medicines in which we can check the next day or say how it's controlling your pain. We can kind of get a sense of how it's working right away. For the thyroid, we actually need to wait. When we're treating with thyroid medicine, we actually need to wait almost 6 to 8 weeks to get levels that really tell us how much extra or less thyroid hormone you need, because it takes that amount of time to get steady levels. So what we tend to do for patients that need thyroid hormone is to start taking it, and then we ask them to come back or have labs in about 2 months. And once the levels had been adjusted in a way that is in normal range, we usually recommend checking once a year.
Okay.
For the too much thyroid, it's a little bit more complicated because it's different treatments.
Juan, I saw a very interesting study, and here you are to talk about it today. So I get to ask you. You did a study discussing the fact that levothyroxine, which is the most commonly prescribed, you stated, thyroid replacement hormone, is way overprescribed in the United States. Would you tell us a little bit about that?
Yes, absolutely. So what we did in this study is that we use a big data set. And what is a big data set? It's pretty much is a list, a huge list of patients that had been seen by different providers across the United States. And this list has almost 100 million patients.
Wow.
And from this list that comes from different areas of the United States, we identified who has been treated with levothyroxine. So our goal was to understand how frequently were people getting levothyroxine and see what kind of values preceded the prescription from levothyroxine, because this has never been done. And the reason why we wanted to understand that is that although thyroid might be a little bit common, thyroid problems, is never to the point that explains why it has become the most frequent, one of the most frequent prescribed drugs. So it is a gap there, and we have not been able to understand why. So we wanted to explore the reasons. And from those individuals who started thyroid medicine, we realized that in 60% of the times, we couldn't find a strong reason for it.
Wow, that's a lot.
Yes, and 1/3, clearly the labs were wrong, and the levothyroxine clearly makes sense. And a 1/3, we found that actually the thyroid levels were completely normal. So that tells you that perhaps people are using levothyroxine in ways that might not be evidence-based, or we don't really understand sometimes how other people use them. For instance, it might be that people are using levothyroxine to get women ready for pregnancy. And what happens is that there are some suggestions that some levels of thyroid hormone might optimize pregnancy in some individuals, and perhaps we are just treating more and more younger women with thyroid hormone to optimize pregnancy outcomes, which is still debatable. It's not that clear that's helpful, but perhaps we're starting using levothyroxine in other conditions that have nothing to do with abnormal thyroid levels. And we also find that, again, a good portion of the population, they are treated for very mild thyroid problems. And I remember beginning, I was telling you that actually over time, as we age, we start developing as normal part of physiology some mild hypothyroidism, and actually it might be protective. Well, we find that that is actually a trigger of thyroid hormone. So remember, we see the labs, patients might have symptoms, it makes sense to treat. But the evidence has shown that only very few patients benefit from that. So the vast majority of patients are receiving thyroid hormone because they don't have a thyroid problem to begin with, or they just have a very mild thyroid dysfunction that's unlikely to bring any benefit to them.
Is there a danger to being on levothyroxine or other thyroid hormone if you don't need to be?
Yes, there is. First, there is the problem of taking a medicine in the sense that if you're already taking plenty, this would be an extra medicine that has to be taken in a very specific way. So this is a medicine that has to be taken in empty stomach. And we always recommend patients 45 minutes before breakfast and with just water, nothing else around it, no vitamins, nothing that has calcium or iron. And if you are a 30-year-old person that has no other comorbidities, it's actually straightforward to take it. Now think about a 70, 80-year-old person that has already 20 more medicines to take. And we are asking them to shift their calendar in a way to make a space for this one. So just thinking about that, I think we're asking quite a bit to patients as well. Now, there is cost of prescription, there is cost of labs, there is the logistics of going to the lab, going to the doctor doing it. And there is also the understanding that 1 in 4 patients who are taking thyroid hormone, at one point, they will have too much thyroid hormone levels in their system. So it means that at one point, the replacement will be too much. And we know when the replacement is too high or too much, there might be a risk of arrhythmias. And there has been some association of strokes and perhaps osteoporosis in patients who have too much thyroid hormone for a long time.
So not a benign thing to take.
It's not a benign thing. Doctors, we tend to think, and I included sometimes, that we always say, it's very easy to take, but in reality, and when you think about everything that comes with that, it's not a very easy thing to think to take.
Juan, you were talking about that as we age, that it might be normal for our thyroid to work a little bit less. Do we use the same lab parameters or values for young people as we do for people in later decades? And if so, does that need to change?
That's a fantastic question, because it has been in the field, the same question. Should we have different thresholds? And the reality is that the future will change in that way. Right now, we consider normal this range, which is normal for the majority of people. And the majority of people who actually contribute to that range are 40, 30-year-old people that usually are healthy. When we understand the ranges in different age groups, and actually by ethnicity or even by gender, we start seeing, or by sex, we start seeing differences in this range. And sometimes now more research is suggesting that the range for you, for me, might be something actually narrowed within what is normal. So right now we have a very kind of not sophisticated way to understand what is normal. And the future, once we have more sophisticated ways to measure what is normal for different populations, and even for different individuals, we might be able to tell exactly when something is abnormal. Because right now, it's just this is normal for the majority of people, but it's not what is normal for you.
This is very interesting, Juan. Do you have anything else to share with our listeners today?
No, absolutely. So one thing that I wanted to share with the public is that one big thing that's happening is that many patients are developing symptoms like the ones that we were describing. And some of those patients do have thyroid problems, and some of those patients do deserve a thyroid replacement. But there is a large group of people that feel neglected in regards to this treatment because they have symptoms, and the doctor keeps telling them it's not a thyroid because the thyroid might be normal. And I see these patients all the time. And what I would trying to do is that first make sure that it's not a thyroid. So clearly do the right labs, but also understand that if the thyroid is not a problem, it's not like the doctor should not abandon the patient, say that's it, go away. Is that the thyroid is not a problem, but what else could be the problem? So investigate the other reasons why somebody's tired, why somebody's gaining weight, why somebody's constipated, understand how they are sleeping, understanding other aspects of their physiology, other aspects of their health. So one big problem that has happened with thyroid is that has been a way to tell patients what they don't have, but it's not the way to take care of patients and help them move forward. And I can see many patients that have been told nothing is wrong with my thyroid, go home, when the answer should be nothing is wrong with your thyroid, but let me help you finding what might be wrong.
That's a terrific point. So having a provider who's willing to help you go the distance and figure it out, that's a
that's a big difference. Yes, absolutely.
Thank you for being here today, Juan.
No, I appreciate it. Thank you very much for the invitation.
It's been a great conversation.
Thanks.
Our thanks to Dr. Juan Brito, endocrinologist at Mayo Clinic, for being with us today to discuss thyroid diseases. I hope that you learned something. I know that I have. We wish each of you a very wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.